Hi, welcome to this week's webinar series. And tonight's topic is navigating, diagnosing, and treatment, specifically to dyslexia. This can be a really confusing topic. You're looking at different people to provide services, and you are unsure of what the difference is between an evaluation and a screener and how that navigates the services you're going to receive. That is the topic for tonight. So let's take a dive in. I think the first thing that would be really helpful to go over is the difference between an evaluation and a screening tool. So when we look at evaluations, typically our expectation is that we will receive a diagnosis, and there are only a few types of practitioners that can give a diagnosis. So let's look into what goes into an evaluation. An evaluation is a series and a variety of standardized assessments. And in order to be able to administer these standardized assessments, the provider needs to have very specific qualifications. That either is a certain degree, college degree, credentials, licensures, memberships of certain organizations. And it's really important that they have these credentials. Publishers will not allow purchase of these assessment tools without proven credentials. Some people, when they do an evaluation for dyslexia, they also will test IQ. Not all will test IQ, but some will. And IQ testing usually takes several hours to do. An overall diagnostic evaluation can take anywhere from 4 to 6 hours. So some people break it up into a few appointments. Dyslexia testing also includes testing executive cognitive function. So we know with dyslexia that we want to test, how well somebody reads, how much they understand how to use phonics, their spelling, can they understand what they're reading? Do they have good rate as far as speed and reading accuracy, which looks at reading fluency. But the other things that go into really strong reading success would be how well our memory is, or how well we process what we see, maybe process what we're hearing. And so there are other areas of the brain and functions of the brain that are tested with extensive diagnostic dyslexia evaluations. Typically, when somebody performs a evaluation on dyslexia, they will, when they write the report and they go over it with you, they'll also provide you with several accommodations and strategies that would be really helpful for your child to be successful in school or whatever it is that they are needing that focus based on the outcomes of the evaluation. So that is a diagnostic evaluation. A screener, on the other hand, is a lot less intensive. So the tools that are used for a screener may or may not be standardized. It can be something as simple as just a checklist, or it can be a combination of a checklist and maybe another standardized assessment, but it usually doesn't take more than 20 minutes, 10 minutes, maybe an hour max. But screeners are very low key in terms of rigor and standardization, which means they cannot give a definitive diagnosis. Screeners are really great to provide you information if it would be helpful to move forward with a diagnostic evaluation, but they are not meant to provide a diagnosis. People that typically can offer a screener are people that may or may not be credentialed. Anybody can provide a screener. They are not required to have a certain educational level or certain licensure or membership to an organization. They may or may not provide you with strategies or accommodations. So just understanding the difference. And of course, with the difference, there's also going to be a big cost difference. Some screeners are free to maybe a few $100s, whereas a dyslexia diagnostic evaluation can run anywhere from about $1,000 to $4,000. So you have that difference in cost, time, and rigor when it comes to the difference between an evaluation and a screener. So who does these, right? Who administers these types of assessments? So let's take a look at the evaluations. The evaluations are typically administered by somebody who can provide a diagnosis. And there are very few people who can actually diagnose dyslexia. Typically, you would go to a clinical psychologist or a neuropsychologist. They typically have a PhD or a PsyD. It is some type of graduate degree that they have earned to be able to administer and score, interpret, and diagnose. They also have a board certification. And then people who can screen, these could be either people that are trained or lay people. So a reading teacher, classroom teacher, occupational therapist, speech therapist. Please note that occupational therapists and speech therapists are qualified to do evaluations of cognitive function and in-depth standardized evaluations. They just do not diagnose dyslexia. So that's a little difference there. Tutors, and the purpose of a screener, as I said earlier, is just to really find out if it's a good indication to have further testing done. All right, so now we know the difference between a diagnostic evaluation and a screener, but where do we go from there? You've done an internet search for dyslexia evaluations and several companies come up. Anything from after school tutoring programs or franchise programs to psychologists, and you're just lost. There's just so many providers out there. It's really important to prep and prepare for a phone call to start asking some really important questions. And these are some points that are great to have on hand when you're on the phone trying to find out the best provider that fits your family. So the first thing you want to know is, do they have credentials? Do they have a doctorate degree? If you're wanting a diagnosis, they typically need to have a doctorate degree in order to do that diagnosis. And what is their degree in? Do they have a degree in something that teaches them how to administer assessments for diagnosing? This would be a neuropsychologist, clinical psychologist. A reading specialist may not have the coinciding doctorate degree to go along with administering some of these standardized assessments that require that level of education. So you want to make sure you know the credentials if you're looking for a standardized evaluation, a diagnostic dyslexia evaluation for diagnosing purposes. If you're looking for somebody to identify areas of deficits for treatment, that's something an occupational therapist or a speech therapist can do. If you're looking for somebody just to get an idea, you're just beginning this journey, you're not real sure, it could be one thing or another, then a screener would be ideal for you. Before you bring your child in for that first day of testing or reading or services, it's really good to just meet the person that's going to be working with your child. Typically, we get a good sense when we're on the phone if we click and it's a good relationship, if you think it's going to be a good relationship or connection with your child. But sometimes, especially if your kiddo isn't really comfortable with people the first time around, you may want to ask if you could come to their office or their facility before the scheduled appointment and just take a tour, meet the person your child will be working with. So that way, when you come in for testing, it's not their first time. They feel familiar. They sort of know what to expect. It's always a good idea to make sure the person that's working with your child or your family is somebody that you can connect to. Making that connection can make a huge difference when it comes to testing. And so you just want to make sure it's open communication. Then you need to start asking questions. And this is just a short list, but feel really confident to ask questions. Sometimes parents will call me and they'll ask a question. I'm like, I'm so sorry. And I always tell them, hey, I am here for you. If I can't answer the question, I'll let you know and I'll try to find the answer. But whoever you're speaking to on the phone should be very open to answering any questions that you'd like. Now, understand that sometimes when you call, your questions may get extensive and may exceed the available time they have to answer, and that's okay. So ask if you can make an appointment to have a further conversation if that's what you're wanting. But it's certainly okay to ask questions and never be afraid or feel, I should know this. I mean, never, you've heard the expression, there's no such thing as a dumb question, and there really isn't. So what are some questions to ask? So questions that people have asked me, and I think are great questions. What is your experience? We already have established, do they have credentials? But what is their experience? How long have they been working with children? How long have they been working with reading? How long have they been working with dyslexia or whatever service that you're wanting? You can also ask for references. What are their methods? How do they provide their services? If they use a certain program, what is that program? If they are a therapist, is their service evidence-based practice, best practices? How do they measure or determine success? So this is a really interesting question. When I first started working with children or individuals who had dyslexia, I started doing a market survey, and I called a lot of the other companies in our area that worked with children with dyslexia. And I asked questions like this: how do you know when my child's done and doesn't need to come anymore? Some people told me when the parent decides they don't want to come, or we just know, or they just feel better. And I'm thinking, that's pretty subjective. There should be objective measures to determining that your kiddo has met a benchmark and it's time for them to graduate from the program. For example, are they measuring a certain reading level in terms of grade or age? Are they retesting with the same standardized tests that they did initially to compare standardized and statistical scores to see if they've gone up or down or changed in any way? So determining when progress needs to be made, or when rigor needs to be increased, or that just right challenge needs to be increased, or when it's time to say, hey, you've graduated, you are all done. It needs to be some type of objective measure. So ask what that is. Also, what is their schedule? What hours are they open? We don't really think of this when we're asking about basic services, but maybe their schedule is not convenient to yours. Maybe they're only open Monday through Friday from 9 to 5, and you can't take off work. Are they open in the evening? Are they open on the weekends? What works with your schedule? Will they be working with the same person if this is something that's going to be recurring? And if so, is it okay if other family members take your kiddo and drop off? Will they interface with other family members in terms of making that connection and bringing that team together? How often do you get updates of improvement? Those are all things that are important. And what can you expect on your first appointment? What can you expect on your second appointment? What can you expect in terms of updates? These are all really important things to ask. And if you want to, I am a very organized person and I love data and keeping charts. So that's what I've done. Is typically when I'm calling a lot of places to find out what's a good fit, I'll make a chart with all the categories and I'll fill it in so I have a nice comparison and I can compare one to the other. You may want to ask about cost. You may want to ask about, do they have loan options? Do they have payment options? Do they take insurance? Do they take HSA? These are all questions to ask as you're planning your schedule. Are they a good fit? Are you getting the services you want? Is this within your budget? What are your options? Feel free to ask all these questions. And then the biggest question is, if I have more questions, are you available for me to call you back? Because inevitably something comes up later. The other question that you may want to ask is, what is the service they provide? I know a lot of times when I was working with kiddos with dyslexia and I did evaluations and testing, the parent would call and ask for a screener. And so I would explain the difference, just as I did earlier a few moments ago, about evaluation and screener. It's really important that you know the difference. And if they say one word versus another, you can ask them to clarify what that means to them, because you want to make sure that what you're anticipating that you want is exactly what they're going to be able to deliver. That's super important. All right. So now that we've navigated the difference between a dyslexia diagnostic evaluation and a screener, who provides each, who can diagnose, and how all of that works and what questions to ask, now we need to take a look at treatment. So there are two types of treatment that you can, two different roads you can go down. One of them is remediation, and this is the most popular and the one you see most. And the other is more therapy, reshaping the brain and how the brain works, kind of, laying down new electrical circuits, if you will, so the brain can hold on to more information. There's a distinct difference between these two, and understanding the differences will really help you know if this is meeting your need and if it's a good fit for your family. So remediation, what that looks like is possibly tutoring, or they're going to start with a phonics program, and it could be a dyslexia program. It could be I've heard of a variety of programs out there, and they may choose one of those, but it's basically phonics based and it's education centric, meaning they're reviewing skills that typically emerging readers learn. So think about understanding vowels or how letter combination sounds go or phonic rules. And so they're really working on these skills, and they may use a lot of different techniques. So they really engage your child, whether they are doing games or tactile things. For example, I'm sure some of you have heard of, drawing letter in sand or drawing letters in shaving cream to get familiar with those letters, that multisensory engagement. One thing to keep in mind when it comes to remediation, if you have a child who has gone through initial reading instruction and they just really didn't do well and you're very concerned and they go through it over and over, they've been retained, you've tried all the options, then going to another reading remediation program probably is not the best fit. And I want you to think about this for a minute, because your kiddo probably does really good in learning other things that they're interested in. And so it's not that they have difficulty learning, more as it is, they just don't have that connectivity going on that should be going on to kind of hold that information in. There's something that's underdeveloped, whether that may be their memory or how they process what they see, but there is an executive cognitive function. There's that root cause. And so until that root cause is met, they may struggle. They may do really well and then plateau. And then when the tutoring's over, they go right back to where they were. And you notice that gap of what they, the ability of what they had versus what they could do. You'll see that gap growing again. So the other type of treatment is building neural pathways. And this is typically when you bring in a larger team and you'll have occupational therapy and perhaps speech therapy on board to work on some of those skills that they specialize in to support all the good work that the teacher or the reading specialist is providing for you. So for example, I want you to think about a house. And I always think about the houses in California that are built in the cliffs versus a house maybe in the Midwest that has a basement or a cement foundation. So when you have a lot of rain in California and a house is on a cliff, sometimes the dirt will give way and the house is built on stilts and the house will slide down the cliff. As opposed to in the Midwest, when it rains really hard, that may not happen. The house is stable, it's got a firm foundation. So all of those, I will just want to interject here as a reminder, dyslexia is a language processing disorder. It is not a visual disorder. It is not a auditory processing disorder or anything like that. However, auditory processing deficits, how your eye muscles work together, how you process what you see, even if you need glasses or not, these can all impact, if they are impaired in any way, they can impact your ability to read and look like dyslexia when it's not. So I just want to make sure I'm clear on that concept before I dive into this. And so some people have both issues, and some people, it's just an executive cognitive function issue, addressing memory, how they process what they're hearing, how they process what they're seeing. And so speech and occupational therapy can help with those things. So some indicators of those things. Think about this. You ask your child a three-step direction. Go grab your backpack and your lunch coat on your coat. We're on our way to school. Go ahead and get in the car. So you get in the car, and 3 out of 5 days of the week, you're making a U-turn and going back home because something was left at home. Or you say, hey, go get your hat, and you look over and they're petting the cat. And they will tell you that that's what you told them to do. And so they may not be processing what you're saying. They heard you, but they didn't process. So these are all skills that at the very least should be evaluated to make sure they're not an issue when we're thinking about services with dyslexia. So just to summarize what we've gone over, an evaluation is standardized. A diagnostic evaluation, let me clarify that. A diagnostic evaluation is standardized and provides a diagnosis, typically done by a neuropsych or a clinical psychologist. Screeners are a lot less intensive. Anybody can administer a screener, And they are just to give us an indication if further testing is necessary. So that's really important. The difference between treatment for remediation is for somebody who just needs that extra intensive review, and building neural pathways or therapy. This is something for somebody who may have other functions going on that they just really need some support so they can hold on to all that reading instruction that's being provided. And last but not least, don't forget the questions and the important points to remember. And those would be understand credentials, make that connection with your child and the caregiver, make sure you're asking questions. I really appreciate all of your attention today, and I hope that this information was helpful. Feel free to leave any comments or questions down in the comments, and I'm happy to get back to you. Also, if there are any topics that are on your mind that you'd love to hear in these presentations and these webinars, just let me know. Thanks, and have a great evening.